and second trip to Gokul Care, where Dr. Vini is practicing, and her parents are also practicing same location, and that's how I was introduced. And her parents are full time present there all the time. It was my pleasure to see Dr. Vini this time because she had finished her medicine and practicing and following footstep to her parents. So it was my pleasure to get opportunity to meet Dr. Vini and get treated by Dr. Vini and her parents too. And it's my commitment to visit every time I visit India to attend that session because it's just fulfilling, and naturopathy is one of for our healthcare. I felt like it's a detoxification, but even though we as a human being need that cleanliness and clearing in our thoughts and mind and also body. So that's how I felt, and I would highly recommend everyone to get opportunity anywhere nearby if you can find the naturopathy and take advantage of that. That will be great. Regarding Dr. Vini, she is, I would say, as far as I know, youngest doctor in my group or who I know, and just found the right life partner who she's going to get married soon. And it's my pleasure that to present here. She is also at this youngest age. She has founded non-profit organization too, and she is a trustee for that non-profit organization and serving so many patients there who are benefiting naturopathy. And with that said, I think I would let Dr. Vini proceed with her presentation, and at the end, I think we will have some questions. I'm sure Alkaji and Dr. Nagaji also will support us in asking questions and all those. So we'll go from there. Let's start. Thank you, Srikanji.
Over
Thank
to you,
you,
Dr.
Praveen
Vini.
ji. Yes, thank you for the introduction. Okay, so let us start with a little prayer. We'll start with three Omkar and Guru Brahma. Okay, sit in a comfortable position. Gently close your eyes. Take a deep breath in and start chanting Om. Oh. 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 Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha, Tasmai Shri Guruve Namaha. Om Shanti. Shanti, Shanti. Gently rub your palm. Give the warmth to your eyes and slowly open your eyes. Hari Om. Okay. Let me share my screen. I hope I'm audible.
Yeah, would you mind doing it in the full screen?
Yes. Okay.
Perfect, thank you.
Okay, so let us start. Today's topic is science of nature cure. I know you all are hearing for the first time about naturopathy, most of you. So these are the basics of what I'm going to discuss with you all today. So before discussing the science itself, we need to understand what is nature cure. Okay. So nature cure is a drugless system of medicine. And according to Henry Lindlad, who is one of the pioneer of naturopathy, nature cure is a system of building entire being in harmony with the constructive principles of nature on physical, mental, moral, and spiritual planes of being. Let me simplify this for you. Basically, what nature cure does is it connects you back to nature. Somewhere in the search of modernization, we have left nature behind. If you see our ancestors, they were more healthier than us, right? The this quality of life was a lot better back then. And in the search of modernization, as we move away from nature, the connection which we lost in the way, more and more diseases came along. So eventually in naturopathy, what we does is we bring you back in contact with nature. And once you are with nature, automatically healing starts by itself. If you see, you all might have experienced this, that in childhood, whenever we used to get sick, the presence of our mother itself makes us more comfortable, right? Same thing happens if we see, all of us are children of what? Mother nature, right? So when we come closer to our mother nature, automatically healing starts from within. That's what we do in naturopathy. Now let us understand the basic principles of naturopathy. Just a second. Yeah. So the first principle says body heals itself. Healing is the term that we commonly use, right? So what is healing? Healing is repairing. Okay. If we simplify it, healing is something when anything becomes abnormal and which again converts back to normal, that process of being normal from abnormal is considered as healing. For example, if I get a cut in my hand, it is abnormal, right? So when it gets properly normal, back to normal, it gets healed, right? So the process of being normal from abnormal, that is called healing. Now, we know that our body is made up of trillions of cells, right? So each and every cell of our body has this capacity to heal itself. So how this capacity is there in the cell? So with the help of energy, vital energy, our cells have this capacity to heal itself. So let's understand what is vital energy. I said that vital energy helps in healing purpose. Okay. In naturopathy, we call it as vital energy. In yoga, you might call it as prana energy. In Ayurveda, you may call it as Jivni Shakti. So apart from repairing, healing, there are other two main roles of vital energy. The priormost role of vital energy is regulating the functioning. Each system that are inside our body, like digestive system, respiratory system, each and every system which is functioning, it is regulated by vital energy. Okay. The second word, it is repairing. Every day, wear and tear, whatever happens in our body, gets repaired with the help of vital energy. And third is cleaning. Every day, each and every cell of our body produces waste. Okay, this waste need to come out of the body. This cleaning process is really important for our body. And this cleaning process is regulated by vital energy. Okay. So basically, if you see, our cell has this capacity, all three things to do. Okay. But the fuel, that is vital energy. Vital energy is like a fuel to a cell to function. Okay. Now, what is the main cause of disease? So according to naturopathy, the main cause of disease is enervation. Enervation is feeling of being drained out of vital energy, that is simply fatigue. Okay. As I said, for a cell, vital energy is a fuel. If there is shortage of fuel, automatically the functioning of the cell will get affected, right? So let me explain this with a simple example. Uh, See, if there is a tank, okay, the water inside the tank is vital energy, and it is connected to our tap with the pipelines. Okay, if water itself is less, then water a sufficient amount of water won't be reaching to our tap, right? If your vital energy is suppressed too much due to your faulty lifestyle, it won't reach sufficiently to the cell. The second reason is if there is accumulation of waste somewhere in the pipeline. Okay, if there is a blockage in the pipeline, sufficient amount of water won't be reaching to the cellular level, right? Like same cellular level, vital energy won't be reaching to cells. And third is if at the same time it has to reach to several places. For example, the tap is on and we do flush, automatically the flow of water in the tap will reduce, right? Same thing happens in our body. If vital energy have to reach to too many places at the same time, it won't be able to reach sufficiently at each and every part. So eventually what will happen if vital energy won't reach at cellular level in sufficient manner, what will happen? So first of all, the thing that will get disturbed is cleaning. Let me explain it with another example. If we get to know that there is a shortage of water, so what we'll do? Where we will save the water? Do we save it in drinking or cooking? Obviously no, because it is the main thing. We need that, right? We will save water in doing dishes, or we'll don't wash clothes for one day probably, right? So we will save water in cleaning purpose. Same thing happens in our body. If fuel is less amount of vital energy is reaching the cell, the first thing that gets affected is the cleaning process. When this thing happens for longer period of time, eventually repairing, everyday repairing which has to be done in the cell will get affected. And eventually, if this continues for longer period of time, the functioning will get disturbed. It's not like that from the initial stage itself, the functioning will get affected. No, the first thing to get affected is the cleaning process. Then next is the repairing process. And eventually, if still vital energy is not reaching sufficiently, it will affect the function. Okay. I hope I'm not running too fast.
No, no, all good. Beautiful.
Yeah. So the accumulation of morbid matter is the main cause of disease. The main cause is disrupted flow of vital energy. But why this vital energy flow is disrupted? The main cause of that is accumulation of waste, morbid matter inside our body. Okay, so due to our faulty lifestyle, our vital energy gets suppressed, which in turn results into accumulation of morbid matters. And accumulation of morbid matters eventually leads to more suppression of vital energy. So they both are interrelated. Okay, so let us see what are different types of waste in our body. We all know stool, whatever we eat gets digested and it comes out as stool, right? Urine, sweat, and there are some parts of the body which are not used frequently that are also considered as waste. The example of it is our fat cells. What are fat cells basically? Fat cells are our storage material. Like it's our storage, glucose storage. If we eat excess amount of glucose, it gets stored in a form of fat molecule. So whenever any emergency situation occurs in our body, eventually that fat molecule will get dissolved and the energy that was stored within, it will get utilized by our body. But how often that emergency situation occurs? We keep on giving our body the glucose externally continuously. So that emergency situation never occurs, right? So excess glucose is continuously getting stored in a form of fat molecules. And eventually, when it accumulates, it may causes various diseases. Like if it get accumulates in the vessels like this, it is called atherosclerosis. It may lead to heart attack. It may lead to strokes. So yeah, uh, eventually accumulation of any sort of morbid matter in our body can lead to chronic diseases. Uh, and not only accumulation of waste. If anything that we are consuming in excess, like several patients I have seen recently, they come to me and say that I am taking calcium supplements since last 5 years, 7 years, continuous. Okay, obviously, after the age of 50, doctors recommend you for the better bone health to consume calcium supplements. But for any supplement, there is a rule you need to follow, that if you are taking calcium supplement or whatever vitamin or whatever supplements, you take it for 2 to 3 months, then give a break in between of 1 to 2 months, and then you again restart it. Because what happens is, if you're consuming calcium continuously, eventually it starts to get deposit. It won't come out of the body as simply it was easily before it was coming out, right? So what happens is, it may cause kidney stone. So many patients have I have seen with the complaint of spur, calcaneus spur growth, which is common when you are taking calcium supplements for longer period of time. And there are researches done that calcium supplements increases the risk of cardiovascular diseases. Especially it increases it by 15% after postmenopausal woman. So if you're taking any sort of supplements, make sure to consult your physician regularly and do the blood work continuously, like in 6 months or in a year. So you can regulate the dosage and everything. Don't just blindly take the pill and go with it. Okay. Now let us understand what are acute diseases. So acute diseases are referred as medical condition that occurs suddenly and lasts for shorter period of time. For example, fever, sore throat, cough, sneezing, vomiting, diarrhea, running nose, rash, headache, etc. Whatever. This kind of diseases are, are not considered as diseases according to naturopathy. According to naturopathy, it is itself a remedial process for the body. What happens during acute diseases? Body is trying to throw out whatever has been accumulated inside. If you see, our body is a beautiful machine. It knows how to take care of itself. Okay. So what it will do, first of all, it will give you intuition. Let me give you an example for it. If you have to attend a wedding for continuously 3 to 4 days, and obviously you have to eat there continuously. So you might feel on the third day that I don't want to eat there. I just want to stay home, eat a khichdi or soup or anything, right? But will you do that? No, because there is a social thing that we need to go there, right? So we'll go there. And even though you have decided from home that you'll only eat something light, salad or khichdi, like, the dal rice or anything. But obviously, after going there, you can't resist yourself. You will eat everything that is there. And eventually, you end your meal with ice cream or pan or anything, right? So what you did, you didn't listen to your body's intuition. So eventually what will happen? Body will take charge in its own hand to remove whatever has been stuffed inside. Okay. So it may cause you any sort of acute disease. Like you will have loose stool, you will feel nauseatic, you will feel a headache, and after a vomit, you will feel a lot better. I think you all might have experienced this sort of things after eating outside for 2 or 3 days continuously, especially in the wedding season. So during this time during acute diseases, when our body is trying to throw out the accumulated waste, what we do usually? We suppress it. We pop a pill and we suppress it. We consider it as a problem, right? So we just suppress it. So whatever our body was trying to throw out, it gets suppressed in within. And eventually, if something is suppressing inside, accumulation of waste is increased in our body, eventually it leads to any sort of chronic diseases. In naturopathy, if you see, the cause of each and every disease is same: accumulation of morbid matter. Because of accumulated waste, vital energy is not reaching at cellular level. So it is causing the functioning of the cell and causing the disease. Okay. And the cure of each and every disease in naturopathy is same: removal of this accumulated toxins. Once this accumulated toxins is removed from the body, automatically the vital energy will reach to the cellular level, and automatically the healing and repairing that was not done earlier will get repaired and cleaned. Okay. And eventually the functioning will get restored. Naturopathy, if you see, it's a simple science. There is nothing rocket science in it. This is the simple cure and cause of any disease. Okay. Now, let us understand what happens during naturopathy treatments. So, when you take naturopathy treatment, your body starts to respond. Okay. Your body will be like, okay, you are doing something. You are trying to remove waste from the body. So automatically it will start throwing it out by its own. If you see all the treatments that we give here, the main core of that treatment, the main motto of that treatment is to remove waste from your body. Okay, each and every treatment has this thing inside it to remove waste. That is the main core. Okay, so when you take any sort of treatment, the body will start to throw out on its own. So how it will throw out? Obviously, it will throw out by causing you acute diseases. So it may happen that whichever condition you have priorly, it may get little bit aggravated and then it will get cured. Or else you will feel nauseatic, your urine output will increase, you may have loose stool, you pass stool for 3 to 4 times a day. Any sort of such things may happen. Headache is really common. So by this all acute diseases, your body is throwing out waste, and this acute disease phase is considered as healing crisis according to naturopathy. Once this healing crisis is done, once the accumulated waste has thrown out of the body, automatically the health will start to restore. Okay, automatically your vital energy flow will increase at cellular level, automatically healing will happen and the functioning will get restored, and automatically you will start feel better from within. Now let us understand what is fasting. If you see, fasting is considered as brahmastra for naturopaths. Let me tell you why. Okay, what is fasting basically? Fasting is complete abstinence of food or any sort of drinks. If you are staying only and only on water, that is considered as fasting. Now, fasting does not cure the disease, but it creates an environment to heal. Okay. Now, let us understand the economy. Like as we have a financial economy, similarly, we have economy of vital energy. Okay. So, as I have mentioned earlier, the three main roles of vital energy: regulation of functioning, second was repairing, and third was cleaning. Fine. So, all the functioning of our body requires vital energy. So during fasting, what we are doing, we are stopping our digestive system completely. So whatever vital energy was getting utilized in the process of digestion will get free. This freed up vital energy, extra vital energy will go and help in the process of healing wherever it is required the most. Okay, so if you have a knee pain or if you have a diabetes, for example, so obviously you need healing or cleaning more in your knee joints. Okay, so the excess amount of vitality that got freed up due to fasting will go and help in the repairing process in your knees. Similarly, if you have diabetes, your pancreatic cells are not working properly, right? So this vital energy will go there, and uh, it will it will do repairing over there, and automatically the cells over there will get repaired. Okay, and the functioning will improve. So if you are aware of it or not, I don't know, but in 2016, this gentleman Yoshinori got a Nobel Prize for his discovery of autophagy. So what is autophagy? Autophagy is a body's way of cleaning out damaged cell in order to regenerate newer and healthier cell. Okay, so basically his research proved that during fasting that has been a part of most of our religions, this fasting stimulates autophagy, a natural process of destructive mechanism of cell, disassembles unnecessary or dysfunctional components, and also stimulates growth hormone, thus renews our body. So in short, if you see during fasting, your whole body gets reboot. Okay, we all reboot our phones, right? Same thing happens in our body. All the cells that are damaged or not functioning properly will get cleaned out of the body, or it will get repaired. So whatever the condition it is, it will help in healing and restoring the functioning. But there are so many rules of doing fasting. Not everyone can do it. So I can't explain each and every rules right now. But if you are doing fasting for the first time, do it under observation. You can take guidance of any naturopath doctor, and you can do it under guidance and observation. That would be better. And yeah, during fasting, one more thing that happens, body will start to clean itself. Again, it may cause you any sort of acute disease. During fasting, so many things happen, so many changes happens. Body starts to throw out the waste. You may get a rash on your skin. You may get a nauseatic feeling. You may puke for 2 to 3 times. And this is the whole process. Like if this thing happens while you are at home without, and you're doing it without like under guidance, you may found yourself in a difficult position. Okay, so it is my strict this say that if you are doing it anytime, do it under observation. Okay. Now, food, role of food. So, food is our building material. You all might have heard this, that you are what you eat. Okay, and I know that most of you are from yogic background, so sattvic, rajasic, tamasic, you all know about it, right? So I won't go there much, but according to naturopathy, heavier the diet, higher the amount of vital energy consumed in digestion. During naturopathy treatment, what we do is we try to give you lighter diet, so less amount of vitality gets utilized in the process of digestion, and automatically the freed vital energy that was freed up, it will automatically go and help in the process of repair. So you all might have experienced this, that if you eat a full heavy meal, you will feel drowsy. You will feel out like drained out of energy. You will just want to sleep, right? What is that? That is because all your energy is going in the process of digestion. That's why you are feeling that. And on the other hand, if you eat something light, you will feel energetic. You won't feel that drowsy, lethargic feeling, because you will have energy left in your body to function. Okay. And there is a mythological story that Shivji told Nandi to give humans a message that we need to bath 3 times a day and eat once a day. But somehow we got a wrong message that we have to eat thrice a day and bath once a day. So if you see, if we eat once a day, that is also sufficient for us to survive. We don't need 3 heavy meals to survive. Okay. And eventually nowadays what has happened, from 3 heavy meals, we have converted it to 6 heavy meals, or seven. I don't know. So many patients come to us and say that we have a habit of eating every 2 hours. So if you're doing that every 2 hours, you are munching something, your digestive system is your digestive system is continuously working. It is continuously functioning. So continuously it is consuming vital energy. So if you have this habit, try to overcome it. You can do one thing. You can just decide 3 hours a day. In between that 3 hours, you eat whatever you want to eat. But other than that, you don't eat. That is the best habit that you can build. If you do this if you do this simple thing, simple change in your diet, you will definitely see benefit of it. You will feel lighter. You will feel healthier. This is a simple habit that we all can apply. Okay. Now let us understand pain. What is pain? Pain is a signal given by our body when something is wrong. It is a signal that needs our attention. I'll explain this with an example. Okay. For example, I have a pain in my knee, mild pain. Okay. So what I'll think? I'll think that this pain is an issue. Okay. I'll focus more on pain. And I'll think, okay, I'll just eat a painkiller and that pain will be gone. And I'll feel better. But really, what was the problem? There was something wrong with the joint. I really need to focus on what was wrong in that joint. But rather, I focused on pain. Okay, and I popped a painkiller and pain suppressed for some time. So body was giving me signal that something is wrong. I didn't listen to that signal. So eventually, what happened? Body start giving me signal in a strong, profound way. So my pain will automatically get aggravated because there was something wrong with the joint. I didn't focus on that. I needed, what I needed to do was I needed to strengthen my joint, strengthen the muscles around the joint. But rather I focused more on the pain. And as I focused more on pain, I didn't exercise, I didn't took care of my knee joint. Automatically, the difficulty that was there, the problem that was there, aggravated. And my body started to give me signals in more profound way. The pain aggravated. And again, with the aggression in the pain, the dose of my painkiller increased. So automatically, I found myself in a vicious cycle of pain and painkillers. So if you see this pain that is happening in your body, that is not your enemy. That is your friend. It is your friend. It is telling you that something is wrong in this particular area. You need to work on that problem, okay, rather than pain. That this is what we do in naturopathy. If you have a pain somewhere in the body, whether in knee or back, wherever it is, we focus on the root of that pain. rather than on pain. So eventually, with strengthening exercises, with all naturopathy treatments, we remove that from the root itself. Okay. Now let us see what are germs. Like according to naturopathy, germs does not cause diseases, but found in diseased condition. What kind of germs? Bacteria, virus, fungi. Okay. Most common nowadays we came out of it was COVID-19, right? So after that whole episode, it is difficult to understand this, especially this, that germs does not cause disease. Let me explain this with an example of COVID itself. Okay. So if you see during COVID, the first wave, what happened? All the old age people, geriatric group, got affected the most because with age, our vital energy tends to get suppressed. With age, we might have developed several other comorbidities, several other diseases in our body. So already our vital energy is suppressed. So when a germ enters in our body, it can spread easily. Okay. So the first wave, the old age group affected was affected the most. Okay. And during first wave, what happened? Lockdown. And during lockdown, the best thing that happened was we stopped eating outside. All outside food are okay. So we, even though we cooked at home like pizza, pani puri, burger, whatever fast food we cooked at home, it was obviously better than what we used to have outside. And because of the fear, in each and every household, precautionary measures were being taken. Okay, so we were taking steam regularly. We were drinking kada, detoxins, various kind of detoxins, and because of all that, because of healthier lifestyle, whole worldwide, the health and lifestyle increased one step. Okay, it took a step up, and what happened after lockdown? As soon as the lockdown was over, the old age group, they were doing everything. They were taking precautionary measures and everything because of the fear, right? But the youth, they were like, okay, we are done with all this kada detoxin. I can't take steam every day now. Nothing is going to happen to me. This all thing happened, right? And youth felt trapped somewhere during lockdown. So after the lockdown, they just started eating everything outside. Some of my friends I know, like after the lockdown, they were like, we have eaten so many things at home. Now I'm fed up of eating at home. I just want to eat something outside. And you all might have seen such youngsters after a lockdown, right? So what happened in second wave? The people who were affected more were the youngsters because the lifestyle that took a step up during lockdown took us two step down after lockdown, especially in the youths. That was the main reason why second wave was more like affected more to the youth. Okay, and if you see, there were third wave, fourth wave, and so on. Okay, but it eventually what happened? Our body got adapted to that virus. It is still there. It is still present. But now our body is adapted to it. We are coexisting now. So it is not affecting us that way that it was affecting us earlier. And if you see, our body's defense system is really strong. It knows how to take care of itself. If any sort of virus, bacteria, anything, any germ, if it enters our body, we have a defense system that can fight properly against it. But somehow, because we have already various diseases, or our defense system is somehow become weak, when these germs enter, and if it gets a conducive environment in our body, it tends to spread and it creates havoc. If our body is healthy, our defense system is strong, no amount of germ can affect our body. If we are already diseased, then and then only germ will enter our body and spread itself. Okay. So this is why in naturopathy we consider that germs does not cause disease but are found in diseased condition. Okay. Now, physical activity and exercise is the balancing bridge between nutrition and drainage. So, if you see what is the change that happens, the basic change that happens in our body during exercise. So that is increased flow of blood circulation. Okay. And what is the function of blood circulation? What is the function of blood itself? Is to provide nutrition to the cell and help that cell to throw out the waste, whatever has been produced by it. That is the main function, okay, to provide the nutrition and throw away the waste that has been produced by the cell. So, increased blood circulation completes the bridge between nutrition and drainage. Especially this point was difficult for me to understand while I was studying it. So during my college days, I uh, I got a chance to go on a trekking camp. So it was like a 5 to 7 days camp, I think. And during that camp, we used to trek for 7-8 kilometers per day. Okay. So when I was there, I noticed one thing that I am eating twice a day heavy meal and I am passing proper stool twice a day. Okay. And as soon as I came back, obviously in my routine life there was not much exercise because I was busy with my college and clinic and everything. So when I came home back, what happened? I'm eating twice a day proper meal, but I'm not passing stool twice a day. Okay, I'm passing stool only once a day. So if you see, if your intake is twice or thrice a day and your output is only once a day, if you apply a basic math, basic logic, does it seem okay? No, because whatever you are eating, the waste is getting produced. And it is important that waste should get removed from your body. And in that process, exercise can help. When I was in that trekking camp, obviously my exercise was high. Because of that exercise, my blood circulation improved. And because of that, that nutrition and drainage bridge got completed. So I know it is difficult to exercise like in today's world. I know it is difficult to exercise every day and 1 hour a day. But if you can, that is completely good. Like it's really good. You should exercise. But if you can't somehow, at least what you can try to do is do something which increases blood circulation instantly. Like if you see, if you walk for 1 hour and if you jog for 10 minutes, obviously you will feel that blood rush in that 10 minutes of jogging. So if you can't do 1 hour walking or 1 hour yoga or exercise, what you can do is you can jog for 10 minutes or do something like you can climb stairs 1 or 2 times, do something that can that increases blood circulation instantly. If you do this also, your body will be really happy with it because somewhere this bridge will get complete. And if you see, if this bridge is not getting completed for longer period of time, like if you see our ancestors during that time, passing stool for 2 times a day was completely healthy. But later on, what happened? Passing stool for if passing stool once a day was considered as healthy. And if you see in my generation, today's generation, passing stool once in 2 days is also considered as healthy. And if you see constipation, we consider constipation as mother of all disease. Because once you have constipation, accumulation of waste is happening continuously inside your body. automatically it may lead you to any sort of chronic disease. Okay, so exercise is really important because it completes the bridge between nutrition and drainage. Okay, okay. So we have so many system of medicines: allopathy, Ayurvedic, homeopathy, naturopathy, Unani, Siddha. Okay, this all system of medicines only gives us a supporting hand. The healing itself is happening by our body. This all system are only providing support. If we go to our first point, that was body heals itself. That implies here that body is healing by its own. We are just providing support. If you have a fracture, what we do, we just stabilize your hand with plaster. And healing of the bone itself will happen by its own. So there are various system of medicine, and what is important to know is each and every system has its pros and cons. If you see, for us as naturopaths, if you come to us with any sort of emergency situation like heart attack or 4-degree burns or any sort of accident or severe injuries, we can't help you. We can't do anything in that condition. Okay, any emergency situation. Obviously, where you need to go at that time is allopathy. You need to take support of allopathy during any sort of emergency situation. But once that emergency situation is done, it's over. When you are stable again, you can come back to us so that we can help you to remove all the toxins that you have taken, like drugs, whatever you have taken during that recovery period. Okay, and we can improve the health by that if you, for example, you had an heart attack, and if you come later on to us, we can help you in sort of manner that you don't have that situation again in your life. You don't get heart attack again. So in that manner we can help. But if you see in any sort of chronic diseases, any sort of lifestyle disorders like diabetes, like BP, any sort of this autoimmune diseases like rheumatoid arthritis, osteoarthritis, lupus, anything, any skin condition, we are the people who can help you the most. Because if any disease is because of your wrong lifestyle, naturopathy is the way to improve your lifestyle. Okay. So in any sort of chronic diseases, definitely naturopathy will help. And whatever I have explained in this whole hour is the science of naturopathy. And it is as simple as this. Okay. And if you see, if you have heard correctly and if you have understood it, you will get to know that in any sort of chronic diseases, naturopathy will help you. Okay, it will help you definitely. A little bit, but not. I don't know. For every person, it may differ. Some majority of chronic diseases we are able to help really very well, but it differs person to person. In some patient, we might able to help, but not too much. But definitely, some help will be provided by naturopathy. Okay, so the basic idea behind this was you need to get aware of which door to knock in whatever condition you are in. Okay, you need to be aware of that. Okay, because all the system here, available systems, are only providing a supporting hand. Okay, the healing itself is going to happen by its own. So the last topic is the most important thing. Yes, the most important thing to get relieved of any disease is patient own wish to get well, determination, faith in the doctor, and faith in the nature's healing power. Okay. I'll explain this with an example. Okay. If two lady are coming to us, both of them are of same age, around 60. and both have similar kind of knee pain, similar condition. Okay, and patient A is coming with this sort of mindset that I want to get cured. Okay, I know what my doctors are doing. I have faith on them. Whatever they will do, whatever they will give me is good for me, and I want to get better. I can't live with this condition for a lifetime. Okay, this is the mindset of patient A. And patient B, she is coming by force. Like there are so many patients, they have this tendency, like they have tried every pathy, every system of medicine, and now they have accepted the disease. They have accepted that, okay, this is my fate. I have to live with this condition for lifetime. They have accepted that, and they are coming here as their last option, last resort. Okay, and after coming here, first day they'll eat here, like whatever we prepare here, lunch, dinner, and everything. If you see it, that whatever we give them as a food to our health seekers, it is sattvic. Obviously, it is sattvic. And so many patients who come to us, they don't have that habit of eating sattvic food. Okay, so obviously on the first day, second day, it might patient might get this little uh, tired that, okay, I don't want to eat this. How this papaya will help in relieving my knee pain. Okay, so obviously initially when someone comes to us, this thing comes to mind, that how this papaya or how this apple is going to cure my knee pain. So this B lady, patient B is coming with this sort of mindset that, okay, that her children are sending her by force, that, okay, you have tried everything, try this also. Now, what do you think? Which one will get more relief? They are staying for same amount of period, like 15 days. What do you think? Which one will get more benefit? Obviously, patient A, because she has that determination, she has that faith in doctor, that I want to get healed. She has that in her. Obviously, she will get more result. Okay, so you all might have heard that by willpower and by determination, patients are able to cure their cancer. Okay, so if people are curing cancer by only by good willpower, why can't you relieve your back pain or knee pain? You can cure it, right? So that is the power of mind is really important. What you think, how you think is really important to get better. Okay. There is a case study that I love to discuss. So, name XYZ, age 59 years, male. When he got admitted here, his weight was 113 kgs, and he got admitted here on 19 January 2016. And he had the main complaint. He had the main complaint of diabetes type 2. Okay, since 20 years, and he has been controlling it with oral medications as well as insulin. He also had hypertension, BP, since last 12 years, and he had obesity. Okay, obviously he had a weight of 113 kgs, and because of sedentary lifestyle, he was obese. And he also had a muscular back pain on and off since last 6 months. Okay, so he stayed here for almost 10 days from 19 January 2016 to 28 January 2016. And in that 10 days, what happened? When he came here on the first day, he was taking insulin 135 units. 135 units of insulin he was taking, and 60 in the morning, 15 units in the afternoon, and 60 units again at the evening. And after his stay for 10 days, his insulin, we reduced his insulin to only 30 units a day, from 135 to only 30 units a day. Okay. And he was also taking medication, oral medication, thrice a day, which became twice a day. Okay, and obviously that BP medication, we didn't touch to that. He was on that. Okay, so his insulin, we reduced his insulin from 135 to 30 units, and one medication we reduced. And obviously he felt really better. He felt good, and he was basically from Rajkot, but was living in Nairobi. So he what he did was he cancelled his flight, and he again came back and admitted himself on 25 Feb 2016. And when he got admitted, he was on 30 unit of insulin, and after 10 days, uh, we completely stopped his insulin, and we were able to restore his natural insulin levels, that we no longer needed insulin for him. And the insulin was completely omitted, and the medicine, he at the end, he was only managing with only 2 medications a day. Okay, so from 135 unit to 0 unit, and from 3 medication to 2 medication. This was his journey, and I have also added his recording, but I think I won't be able to share it right now. But yeah, eventually, and yeah, after that, he was the patient who was really following everything what we told him, what we advised him, and eventually he lost 25 kgs. That was a huge thing for him as well. And with his recommendation from Nairobi, and from uh, various other states, I think from itself Nairobi, mainly Nairobi itself, 274 other health seekers visited our hospital, and obviously we were able to help most of them. And this was one of the best case study that we have here, and there are several other case studies which we post in our YouTube channel. If you want to see other testimonials, it is available at our YouTube channel, Gokul Nature Cure Center, Gomta, and our website is also there. You can see more details over there. So this is my phone number and my email ID. You can anytime contact me for any detail. And yes, we also do online consultations as well. Okay, so you can contact me for that also. The last thing I will like to share is, uh, if you see, naturopathy is really simple. It is nothing. There is nothing rocket science in it. Whatever I have explained you in this 1 hour, I think that is what naturopathy is. It is a simple science which connects you back to your roots and helps you cure yourself from within. Okay, and this is the system which focuses more on precaution as well. Okay, it helps to cure, but it is precautional also. And naturopathy, in naturopathy, what we teach is lifestyle. If you know how to live, there is no way that your quality of life will get compromised. If you know how to live, obviously you will lead to a healthier life. Okay, and being at any sort of naturopathy hospital is the start of your journey. If we often tell our health seekers that we service our vehicles like a car or two-wheeler every 6 months, right? Same thing. We should also do it with our body as well. We need to service our body. This is going to any sort of naturopathy hospital is sort of servicing your whole body. Body itself is also a machine, right? So as we service our vehicles, same thing, we can do it with our body as well. So simply in one word, naturopathy is nothing but a lifestyle, and it also focuses more on precaution. And you all might have heard that precaution is always better than cure, right? So with that statement, I like to finish. Thank you. If you have any other questions regarding this, you can ask.
Well, thank you so much, Dr. Solanki. Thanks a lot. It was a great presentation overall, especially at your young age. That much of understanding, it's amazing. So we could see that
Thank
the
you.
training you must have gotten already. So I think
Thank
we
you.
have one or two questions already. I'm sure there will be more on the live platform. So would you like me to read, or you want to do it from your side?
Yeah, I'll do.
Okay. I'm just going to stop the recording so that if somebody is asking
Yeah,
some particular question.
In addition,